Hello, my name is Nina Espinoza. Thank you for viewing my presentation on my article review on structural family therapy for single African American mothers. This is a brief overview of what we'll be discussing. This article focuses on single African American mothers in the United States and how they are still negatively affected by macro as well as micro systemic variables even after the civil rights movement. This current study seeks to assist these mothers in addressing the underlying issues of their interactions to enhance coping capacities and protect from the effects of racism and discrimination. Some findings in this article, it did discuss the history of structural family therapy, how it was developed by Salvador Munchin in the 1960s. It also discussed that it has been shown to be effective in Latino and African American families. And in order for it to be so effective, it does require cultural awareness as well as self-awareness to be effective in this therapy method. And it did discuss that some of the limits have been that it may have patriarchal perspectives. And also, some people have argued that it has little regard for the effects from outside systems because it is so focused on the family system. In regards to diversity, this article does focus on African American women who experience discrimination at two levels, both in gender and also in ethnicity. One quote from the article states that in addition to the inherent stressors of being a single parent, countless African American mothers in the United States are negatively impacted by the macro and microsystemic variables. Responsiveness to the social context and those social effects do make structural family therapy uniquely suited to working with African American single mothers. And it also discusses the strong Black woman concept and how it appears to be empowering. It does appear to be a empowering portrayal and a powering image of Black women. Research has shown that it may actually be harmful and undermine the African American mother's need for support. In regards to implications for practice, structural family therapy is a very effective practice for social workers because of the empowerment and because of the systems perspective. The techniques are to join the family as a provider. It's a very intimate method. So you will join the family, watch the family enact their usual discussions or usual interactions. And during this, the provider would map out the family and see where the power is, where the relationships are, and what the structure of the family is. And then the provider will unbalance that structure to empower, in this case, the single mother to put her at the top of the hierarchy of the family structure. Again, the cultural competence is extremely important in this method, and to be able to provide the culturally competent empowerment is very imperative for providers, and that is a very in alignment with the goals of social work. Therapist self-awareness is also extremely imperative in this method to prevent from any sort of bias or discrimination from the provider, and that is also very much in line with the goals and ethics of social work. Overall, this is a very fitting intervention method for single African American mothers due to the cultural competence piece, and as well as the focus on empowerment. For my critical assessment, I was very excited to learn that structural family therapy was created specifically for African American and Latino families. And what I've learned this far, I don't remember that being taught. So that was very interesting to learn in this article, the motives of the development of structural family therapy. I also see how there is the possibility of pathologizing cultural practices from providers who do not have that cultural competence or that self-awareness in working with the family structures. Somebody who doesn't understand a particular culture may pathologize certain practices that they have within their family. For example, maybe younger siblings sharing a room may not be a big deal to one particular culture, but somebody from another culture might say that's not okay and, try to change their family in that way. Another assessment was that the case vignette provided in the article was extremely informative. It did show a very real world situation where this method could be applied to a family to empower a single mother. The summary of the article, as I mentioned, it did touch a lot on the history of the development of structural family therapy, how it was developed by Salvador in the 1960s during the civil rights movement, and the intention of it was to empower ethnic minorities in coping with the systemic injustices. It did touch a lot on the history of the discrimination against African Americans and specifically African American mothers, and how they face not only that gender discrimination as a woman, but also the racial discrimination as African American. One quote from the article stated that structural family therapists use a number of techniques to disrupt dysfunctional organization in the family system and promote problem solving. And it did touch a lot of base on the techniques of structural family therapy and the process. And as mentioned before, it did address that strong black woman concept, and how that is not the best way to empower African American mothers, although research has noted their resilience and their strength, that it is undermining to the black woman, and it does put unrealistic expectations. And research has shown that they do not embrace this identity of the strong black woman because it does put a lot of pressure. And also, it touched on the importance of empowerment of African American mothers in structural family therapy and just in general, but how to apply that empowerment with the structural family therapy methods for the therapist to join the family and join with the mother and reestablish the mother at the head of the hierarchy, and not just within her own family, but because in African American cultures there is usually a strong presence of extended family. So therefore, she would have to establish her power within her own family as well as the extended family. And it also did touch base on the limitations, views from a feminist perspective. They do feel that this intervention may be patriarchal, and it does generally try to place the male at the head of the family and things like that. But as long as providers are aware of these things, it's not hard to protect against these limitations as far as the patriarchal nature, and as well as potentially pathologizing cultural practices. Thank you so much for viewing my presentation.